Now that you have a sense of how we fix an implant into the bone, let's talk about what materials replace the ball and socket, specifically the parts that rub against each other. These are the bearing surfaces. Hello, I'm Dr. Amit Atrey. I'm an orthopedic surgeon and I specialize in hip and knee replacements. As I said, the bearing surfaces in a hip replacement are the two parts that rub together. In the case of the ball and socket, it's the head and the liner of the cup. There are many head and liner options for your surgeons to choose from. They will choose materials that work for you based on medical evidence and their professional experience. There are positives and negatives to all options. Many surgeons in the US and Canada like a hard surface against a softer one. So a hard metal head against a plastic liner. The plastic we use in hip replacements is called polyethylene. It's usually a white or off-white plastic. When the metal ball comes into contact with the polyethylene liner, the two materials function like your own ball and socket. Sometimes surgeons will use an alternative to metal head like this, a ceramic head or something similar. Again, your surgeon will aim to choose the right type and size of head for you. While the metal and ceramic head is hard, the polyethylene liner is soft. But it's not soft in a weak or deteriorating way. In fact, with old plastic, 60% of hips were lasting 25 years. Now we have newer, better polyethylenes that seem to wear away 4 times less than the old ones. But eventually, just like our own bodies, using your hip replacement on a day-to-day basis can cause the polyethylene, this softer part of the hip replacement, to wear away. Because polyethylene liners can eventually wear away, some surgeons prefer to use hard-on-hard combinations, like a ceramic head against a ceramic liner. But strangely, up to now, both hard-on-hard and hard-on-soft last a similar amount of time. As there are so many options, you should discuss these with your surgeon. How long will your hip replacement last? This question is really important, especially for you young patients out there. I cannot answer this question accurately, but we can give you a guide. This medical research paper was published in The Lancet, a well-respected medical journal. The case series follows hip replacements done over 25 years ago. The survivorship of hip replacements was between 56 and 75% at 25 years. To put that another way, at least 6 out of 10 hips were still in place after 25 years. That's already pretty good. And we must bear in mind that study looked at hip replacements done a long time ago. Since then, technology has got even better. Implant design has improved. Techniques we use as surgeons have advanced. And most importantly, the bearing surfaces we talked about, the heads and the liners, have dramatically improved. So although I can't say exactly how long these new hip replacements will last, I do tell my patients that 6 out of 10 hips will likely last at least 35 years. You may consider this. Your hip replacement is like buying a luxury sports car. If you respect the car and drive it carefully, that car is going to last for a long time. But if you drive like a Formula 1 star, if you rev the engine and slam the brakes, then your parts will wear away quicker and need changing more often. It's the same for your hip. I never stop my patients from doing what they want to do. If they want to run or ski or play tennis, I tell them they should. Life is for living, and this operation restores your quality of life. But just like driving a fancy sports car, Please move with care. Joint recovery is your daily, at-home, physio-guided rehab program. You'll get 30 days of videos, one for every day of your first month after surgery, to get you to be your best self as soon as possible.